Well, hey guys, and welcome back. Today I'm going to be talking about Trulicity and how to do the injections. So, Trulicity is a glucagon-like peptide agonist. It is used in patients with type 2 diabetes to help control blood sugars in conjunction with diet and exercise. The main side effects of Trulicity are most commonly are going to be gastrointestinal side effects such as nausea, gas, bloating, loose stools, constipation, or diarrhea. These symptoms are often they're quite common, but they often will dissipate or completely go away after a week or two on the medication. So oftentimes I tell my patients, if it's not too intense, try to stick with it because usually they will go away. If they are too intense, obviously let your provider know. If you do have a history of medullary thyroid cancer, pancreatitis, or multiple endocrine neoplasia, then this is not a medication for you. But with that, let's get to how to do the injections. There are 3 sites where you can inject Trulicity. One is right around the belly button, at least a couple of inches away from the belly button, but in that entire area, on the backs of the upper arm or on the front of the thighs. You definitely want to rotate your injection sites every week. This is a once-a-week medication, and every week, it really doesn't matter what time of day you inject it, as long as it's on the same day. I often do recommend that patients try to remember to take it at the same time because I think that helps kind of you to remember to do it. There are 3 steps on how to inject it. The first one is that you are going to take off this gray cap that's on the end. So this is what the pen looks like. And to remove the gray cap, you just pull straight down. So pull that straight down and it comes off, and then that you can discard. This clear end, you're going to place it against your body firmly in one of those 3 areas that I mentioned. Next, you're going to take a look and you'll see that it is locked. So you want to unlock it. And then you're going to push on the green button here for about 5 to 10 seconds. And as you heard there, you hear 2 clicks. The first click is the start of the injection. The second click tells you that it's completed. You'll also know that it's completed because, as you could see, you can see the plunger going down. And that's really all there is to it. You obviously want to make sure that you remember to wash your hands prior to doing your injections. Your Trulicity pen does need to stay refrigerated prior to use, but it can be taken out of the refrigerator for up to 2 weeks and still be good for use. So if you need it for travel and you don't have a good way to refrigerate it for travel, that's okay. It just needs to be used within 2 weeks of taking it out of the refrigerator. As far as disposal, you'll want to dispose of it in a sharps container because remember it does have a needle inside. So make sure that you dispose of it properly, and that's it. It's actually quite easy. You will never see the needle because it's tucked away inside your pen. You see the plunger, but you won't see a needle. So it's actually quite friendly in that way. It comes in 4 different doses, 0.75 milligrams, 1.5 milligrams, 3 milligrams, and 4.5 milligrams. So before you inject, make sure that you are checking your pen to make sure, 1, that it's not expired, 2, that you have your correct dose, and 3, that there's no cloudy particulate and that it does look clear. Well, I hope this video was informative on how to properly administer Trulicity injections. If it was, click like below and subscribe. I'm Dr. Villavicencio with endocrinology, helping you to find your perfect balance. Until next week, hasta luego.